If you are looking for ways of how to lower high blood pressure, perhaps we should first talk about what causes high blood pressure in the first place. Well, the truth is that there are many different causes ranging from poor diet, lack of exercise, stress and hypertension. High blood pressure that is left untreated can lead to other more serious conditions, including stroke and heart attack. Having some knowledge of what causes high blood pressure will help you to avoid the risks. Changing your diet and watching what you eat and drink will greatly help reduce high blood pressure. One of the major causes of high blood pressure is cholesterol. People with high levels of cholesterol are almost certain to have higher blood pressure when compared to someone with a healthy diet. Cholesterol causes fatty deposits to coat the artery walls. Over time, these fats form into a hard plaque that reduces the size of arteries and blood vessels, making them smaller and smaller. Your body still needs to pump the same amount of blood through these blood vessels, and this is what causes high blood pressure. Another great way of how to lower high blood pressure is to reduce the amount of sugar in your diet. We all like our sweets and desserts, but here again, simply by lowering your sugar intake can really help reduce high blood pressure. Eating high amounts of sugar or sugary foods causes your blood to thicken due to the glucose. If your blood is thicker than it normally should be, it is again harder to circulate and so causes high blood pressure. Another good way to help reduce high blood pressure is to cut down on other things that have been shown to be causes of high blood pressure. These include nicotine, which is in cigarettes and other tobacco products. Excessive alcohol consumption has also been proved to increase the risk, so by lowering your alcohol intake it will also help reduce high blood pressure, as will cutting down on the amount of caffeine in your diet. Exercise has also been shown to greatly help reduce high blood pressure, but always consult your doctor or a medical professional before taking up any strenuous exercise program, as the wrong type of exercise could make your symptoms worse. Weightlifting is something that should be avoided because this can be very stressful on the heart. Highly intensive cardiovascular workouts are also not good for people with high blood pressure, as this type of workout greatly raises your blood pressure. Moderate exercise is the best way, and over a period of time you will lower your cholesterol, your weight and therefore your blood pressure. Things like yoga and slow movement exercises are especially good to help reduce high blood pressure, as they are very heart-friendly. Always practice warming up and cooling down exercises before and after your main exercises. This slowly raises and lowers your blood pressure rather than causing dangerous spikes. If you're concerned about lowering your blood pressure, don't despair. There are high blood pressure treatments that really work, and the good news is they don't involve medication. Keeping your blood pressure under control is an important step to prevent strokes and other serious health problems. The following important high blood pressure treatments are easy to implement, and you'll see the results of a lower blood pressure. The range of normal blood pressure for adults is 120/80ths or below. If your blood pressure falls within the range of 120/80ths to 140/90ths, you're considered in the pre-hypertension stage. Anything about 140/90ths usually requires treatment using medication to lower blood pressure. You can often lower high blood pressure, hypertension, effectively by incorporating lifestyle changes. Adopting and following healthy lifestyle changes each day can help you prevent using prescribed medications for high blood pressure treatments. Increasing your activity level is one of the best ways to begin to lower your blood pressure. Exercising at least 20 minutes a day is a great start in keeping your heart healthy and controlling blood pressure. A simple 20-minute walk around the block or any activity that elevates your heart rate will do wonders for controlling your blood pressure. If you smoke, stop now. Smoking injures the walls of your blood vessels and contributes to the hardening of your arteries. Even though smoking does not cause high blood pressure, it is unhealthy for your heart. Smoking contributes to heart and blood pressure problems. Don't drink too much alcohol. Alcohol consumption raises blood pressure, so alcoholic drinks should be limited to 1 drink a day for women and 2 drinks for men. Research has also proven healthy eating habits reduces the risk of developing high blood pressure and helps lower an already elevated blood pressure. Diets low in sodium and fat are ideal. If you're striving to avoid high blood pressure in the future, diets that stress eating fruits, vegetables, low-fat dairy products, fish, poultry and are low in total fat, saturated fats, and cholesterol will also assist in lowering blood pressure.
The information provided here is intended for educational purposes only. It is not a substitute for professional advice and should not be construed as such. The content is based on general knowledge and may not be applicable to individual circumstances.